my name is Kayla. I'm going to perform administration of subcutaneous injection skills video. So first, I would verify the healthcare provider's order. I would gather my supplies. I have gloves, gauze, alcohol swabs, 29 or 30 half-inch needle, 29 or 30 gauge half-inch needle, 1 milliliter syringe. In this case, we have the needle already permanently attached to the syringe, a band-aid if needed, and the medication vial. Next, I'm going to verify my 6 rights of medication administration, which include right patient, right route, right time, right drug, right dose, and right documentation. I'm going to check the medication order in the EHR. I'm going to do any dosing calculations. At this point, I use dimensional analysis. So I do the order dose times what's available. And so I got 1,000 units over 1 dose times 10 milliliters over 10,000 units. And I got 1 milliliter per dose. So next, I would enter the patient's room and introduce myself. Hi, my name's Kayla. I'm going to be your nurse today. I would provide privacy, close any doors and curtains. Can you verify your name and date of birth? Check the wristband. Do you have any allergies? I would note and document any allergies. I'm going to let them know that I'm going to be administering a heparin medication injection. It's 1,000 units or 1 milliliter of this medication. It's a blood thinner used to treat and prevent blood clots. The way it works is by disrupting the formation of blood clots in the veins. Some common side effects include irritation and redness at the injection site. You might feel slight burning and stinging as I'm injecting. If you have any adverse effects such as shortness of breath or fever, please report them to me immediately. Do you have any questions? So I would perform hand hygiene and apply my gloves. Get my syringe and needle with the cap still on and facing up. I'm going to fill it with the air to the prescribed dose of 1 milliliter. I'm going to insert it into the vial. And I'm going to inject the air into the vial. I'm going to hold the vial upside down and allow for the medication to fill the syringe to the prescribed dose of 1 milliliter. At this point, I'm going to tap to release any air bubbles and then gently push back the air into the medication vial. If there's still air bubbles, I would inject the air again and make sure I get my correct dose. I'm going to keep the needle clean and use the 1 scoop method. And I do want to show you guys, I have 1 milliliters in here. Okay, next, I would select my appropriate site for a heparin injection. An ideal place would be 2 inches to the right or left of the umbilicus. I'm going to inspect the area for any bruising, inflammation, or edema. I would make sure I palpate and stay away from any masses or tenderness. Next, I'm going to grab an alcohol swab and clean it starting from the center and outward about 2 inches. I'm going to make sure I pinch the skin and from top to bottom, the needle should be half that size. Next, for an average size adult, I'm going to grab my needle now. I do want to pinch the skin for an average size adult. I'm going to inject the needle quickly and firmly, and it should be at a 45 to 90 degree angle. Next, I want to use my non-dominant hand to place it at the end of the syringe and use my dominant hand to inject over several seconds. at the same time that I'm removing quickly, I want to grab gauze and take the needle out. I would place it in the sharps container. I would discard that in the trash. I would get a new alcohol swab and place it in the center, working outwards about 2 inches. I would place a band-aid if necessary. Make sure they're not allergic to any adhesive bandages. I would remove my gloves, place them in the trash, perform hand hygiene, and document what I did.